A very good afternoon from Singapore to all our audience members tuning in for this second part of a two-part webinar series that looks at the 25 years of women, peace and security in Indo-Pacific. With this part, today's webinar discussion focusing exclusively or focusing more, I should say, on the emerging threats and challenges. So to all our audience members who are tuning in from whichever time zone you are in from, as well as to our speakers, good morning, good afternoon, good evening, and thank you for joining this webinar series that is organized by the S. Rajaratnam School of International Studies, RSIS, in partnership and collaboration with UN Women. I am honored to be the moderator for this second part as one of Singapore's two representatives to the ASEAN Women for Peace Registry. My sister member and the other representative to the ASEAN Women for Peace Registry, Dr. Tamara Nair, kicked off the webinar series in the first part, which really looked at assessing the positive gains and achievements of the WPS implementation since the landmark UN Security Council Resolution 1325 on 30th October 25 years ago. That webinar covered a lot of ground in assessing how WPS, I think the pursuit of WPS at both international, regional, and national levels has really been this interesting mix of landmark, historic, if you will, institutionalization and mainstreaming of important priorities and processes. But nevertheless, despite the positive progress and achievements, including expanding the WPS agenda and as much institutional embedding that could be done via national and regional action plans, particularly in regional bodies here in this region, such as ASEAN. Despite these gains, I think there were observations also in the first session about persisting gaps and challenges that, of course, speak to also the current moment that we find ourselves in, which has this kind of rise in militarism, authoritarianism, and conflict, and the ongoing challenges, of course, of resources, attention, and I think also the rising need for the different contexts in which the commitments are pursued at national levels. And of course, there are threats and challenges which are emerging. Some of these have been referred to as non-traditional security challenges, such as climate change, for example. There are, of course, I think, continuing concerns for gender and health in the context of such emerging non-security challenges. And I think one very new emerging challenge that we are all grappling with deals with the online aspects, digital security, but also I think the kind of online gender-based violence that is taking place, as well as the disinformation. And all of these are underpinned also by maybe misogynistic anti-gender type of attitudes as well in this current moment that we find ourselves in. So with that as context, it is my honor and pleasure to continue my own learning journey by really listening to and benefiting from the insights of five eminent speakers and panelists who are all experts in the areas that they cover with relation to this broad topic of women, peace, and security issues, emerging challenges, and threats to implementation of women, peace, and security in this region, this broad region of the Indo-Pacific. And we have about, I think, 2 hours within which to hear the insights from our esteemed panel of speakers and get some further discussion via question and answers. So very quickly, I'd like to read out the lineup of the speakers that we have before each of them will take 15 minutes to walk us through more details of their insights that they have to share with us. Starting off the panel will be Her Excellency Elvira Souza Carvalho, who is the Secretary of State for Equality in the Democratic Republic of Timor-Leste. She will be focusing on the progress, the gaps, and the future of women, peace, and security implementation in Timor-Leste. Then we will also have Ms. Teo Yi-Ling, who is the Adjunct Senior Fellow in the Center of Excellence for National Security at the S. Rajaratnam School for International Studies. Her expertise is really on providing research and advisory support to the policy and legal issues related to economic security, regulation, and the governance of online spaces. And Yi-Ling will be sharing her thoughts and updates on the legal measures and aspects of ensuring digital security, speaking, of course, from the work that's been done here in Singapore for this emerging challenge that we are seeing and we've been trying to monitor. We also have Dr. Ayesha Wee Abu Bakar from she's the Associate Professor in the School of Business and Social Sciences at Al-Bukhari International University, Malaysia. She'll be joining us shortly. I think Ayesha, who is also representing Malaysia at the ASEAN Women for Peace Registry, has long experience in, I think, providing inputs to and developing the national action plans on women, peace, and security. So we'll be hearing her insights on, I think, those kinds of challenges and so on. She'll be joining later shortly, and in the current lineup, she's our third speaker. Then tuning in from the Monash University campus in Indonesia, we have Dr. Gabriela Fernando, who is Associate Professor for Global Health there on the campus. She's actually also one of the foundational academic team at the Monash University's Indonesia campus. And her work, her research and everything really has given attention to gender and health. Her postdoctoral research was on that, if I recall correctly, at the United Nations University and at Monash University. One of the areas of her research focus looks at the women's health and gender equality aspect. And we'll be hearing more about, I think, the overall regional perspective and the women's health issues and challenges in relation to that in her presentation later this afternoon. And not least, rounding off the panel, we have Dr. Nicole George, who is Associate Professor in the School of Political Science and International Studies at the University of Queensland in Indonesia. And Dr. George's expertise also is really focused on topics that are related to the gendered policies of conflict and peace building, of violence, security, and women's participation. And we'll be hearing more of her insights on the securitization of WPS in the Pacific as we are, this panel is looking at the different experiences and observations from the Indo-Pacific. So with that broad interview, a contextual introduction, I should say, my apologies for taking up too much time as moderator. The time really should be for the speakers. And it is now my pleasure and honor to give the virtual floor, the microphone, to Her Excellency Elvira Souza Carvalho for your thoughts, please, Madam Secretary. Over to you.
Ladies and gentlemen, thank you very much for inviting me, the Secretary of State for Equality of Timor-Leste, to participate in this webinar. And it is an honor for me to join and share the progress and the gaps and the future planning of the implementation of United Nations Security Council Resolution 1325 on women, peace, and security. And we also would like to congratulate us for the 25th anniversary of the resolution and a landmark commitment that to guide our collective journey towards peace, equality, and inclusive security in the region and across the world. For Timor-Leste, the Women, Peace, and Security agenda is very important and profoundly meaningful, as Timor-Leste is a nation that emerging from a conflict. We have always committed to the full participation of women and girls in all areas of the development since Timor-Leste has restored its independence in 2020. Our nation history, some of you might know, that is shaped by the courage and the resilience of Timorese, including the Timorese women. And women who carried not only the burden of conflict, but also hope and freedom, reconciliation and nation building. Their contribution, or the women's contribution, reminded us that peace cannot be sustained if half of the population is excluded from decision-making process. Therefore, since 2016, Timor-Leste has implemented its first national action plan on peace, women, peace, and security from 2016 to 2022. And under an earlier national action plan, the government prioritized women's participation in political life and security forces. For example, women constitute 15% of the national police force and 9% of the armed forces, providing mediation training to community mediators. Moreover, in late 2024, the National Police launched its own gender strategy from 2024 to 2028, aligned with the National Action Plan 1325, reinforcing gender-responsive policing, recruitment, or promotion of women officers, and also sexual harassment prevention, and also focus on the promotion of gender equality in security and defense forces. Currently, at the parliamentary level, at the national parliamentary level, women consist of 36.9% women in the national parliament. It consists, it's 24 out of 65. It's I can say it's a progress, and it's a progress that we are proud of, that we have one of the highest percentage of women in Asia, especially women in the national parliament. And this year, Timor-Leste is proud to mark another important milestone, the approval of our second generation of National Action Plan on Women, Peace and Security from 2025 to 2029. This plan builds upon the lessons of our first National Action Plan and reaffirms our national commitment to advancing the 4 pillars of the Resolution 1325: participation, prevention, protection, and peace building. Through the new National Action Plan, we aim to first strengthen women's leadership and participation in peace building, conflict prevention and protection, and security institutions. The second is to enhance the protection of women and girls from all forms of violence, including sexual harassment, gender-based violence. The third is integrate gender perspective in national security, defense, and justice sectors. And last, to promote social cohesion, community resilience, and community conflict prevention, and women's economic empowerment as the foundation of sustainable peace. And Timor-Leste approach is grounded in the principle that peace is not only the absence of conflict, but also the presence of equality, justice, and opportunity to everyone to live in dignity and free from violence. And the 9th constitutional government, this government, And the Secretary of State for Equality, in partnership with both national and international partners, also investing in the care economy, strengthening the protection mechanism, and ensuring women's voices are heard at every level of governance and community decision-making progress. Ladies and gentlemen, as we reflect the 20 years of Women, Peace and Security agenda, we recognize both progress and persisting and existing challenges. Across our region, women continue to face barriers to participation and disproportionate impacts of crisis and natural disasters and new threats, including digital violence, disinformation, and online harassment. ASEAN's growing engagement on women, peace, and security provides a strong platform for shared learning and coordinated actions. Timor-Leste is the newest member of ASEAN, stands ready to contribute its voices, experience, and commitment to advancing this agenda together with our regional partners. By implementing the second generation of National Action Plan 1325 on Women, Peace, and Security, the second implementation of the National Action Plan on Gender-Based Violence 2022 to 2032 as a powerful mechanism for eliminating violence against women and girls. The third I just want to share with you that we are now finalizing the revision of the law against domestic violence to include criminalizing incest cases in addressing gender-based violence. And fourth, the advancement of the Mobisi Declaration on Women's Economic Empowerment and the institutionalizing of the Gender Equality Working Group across line ministries to integrate gender across all areas and the governments to improve women's economic resilience. The last one is through interministerial collaboration. We are working with various ministries and stakeholders to ensure that all nationals' commitments on gender equality and the CEDAW concluding observations are integrating into governmental annual plans and budget to ensure its implementation. The Secretary of State for Equality is working closely with international partners to advancing the gender equality in Timor-Leste and to ensure that line ministries and the government is complying on the implementation of international commitments and the national policies to advancing gender equality in Timor-Leste and the protection and the promotion of gender equality in security and defense forces. And in closing, I wish to express my appreciation to the S. Rajaratnam School for International Studies for convening this important dialogue, and I hope that this important dialogue will contribute to the implementation of National Action Plan 1325 on Women, Peace and Security in the region, and also for the protection and ensure peace and security in the region. Thank you very much.
Thank you very much, Madam Secretary. And speaking for the panel, as well as for the ASEAN, for my colleagues from the RSIS, the S. Rajaratnam School for International Studies, and of course, as a member of the ASEAN Women for Peace Registry, may I extend warm congratulations to Timor-Leste upon its recent full membership in ASEAN. The points that you have highlighted, particularly how Timor-Leste is ready to contribute to the ASEAN efforts in this area through linking, I think, your national level implementation priorities to the regional commitments at the ASEAN platform that, of course, Timor-Leste has just joined, I think really highlights the recognition that Timor-Leste has for the syncing of, the synchronizing of regional commitments and national action, which I think has been one of the continuing features of how we all try to give effect to the commitments that we make at the international or the regional levels, and translating that into action at the national level, which is, I think, one of the points that have also been expressed as both progress and work to continue when it comes to the WPS agenda pursuit. So once again, thank you very much for your points that you have shared, Madam Secretary. I'm sure there will be questions later on in the discussion from our audience members. But for now, let me turn the microphone, give the floor to Ms. Teo Yee Ling for her insights on the topic of digital security and the legal aspects of that. Over to you, Yee Ling.
Thank you very much, Dr. Mo, for the introduction, and an early good morning to everyone from Rotterdam in the Netherlands, where I'm currently based. Thank you to Dr. Tamara, Naya, and team for all your efforts in convening this important session. And I'm grateful that I'm able to make a small contribution to this discussion via this presentation. So thank you for the opportunity. So my presentation will outline the legal and regulatory framework that Singapore currently has in place for addressing online harms. But first, I think it's good to have some context. Singaporeans are apparently increasingly reporting exposure to online harms. The Ministry of Digital Development and Information's, I'm going to use the short form MDDI from now on because it's a mouthful. Their recent Perceptions of Digitalization survey found that more than 4 in 5, 84%, respondents in Singapore encountered harmful online content. And 1/3, around 33%, experienced harmful online behavior in the past year. Sadly, sexual and violent content as well as cyberbullying were among the most frequent types of harmful online content encountered. Now, unsurprisingly, this growing exposure to online harms results in deeper psychological impacts, as shown in a recent study entitled 404 Help Not Found, Lived Experiences of Online Harm Survivors by the Singapore non-profit organization SG Her Empowerment. I'm going to use the acronym SHE from now on, which disclosed how victims' sense of helplessness was compounded by a few key aspects. Limited and or unclear options for recourse, online anonymity of perpetrators, and the tendency for self-blame or victim blaming by downplaying their experiences. So online harms, as another effect, have also distorted online participation and discourse. A study conducted by SHE in 2023 found that 3 in 4 respondents were uncomfortable expressing their personal views on potentially controversial topics online, as they feared being targeted and harmed. Furthermore, the majority of respondents also reported resorting to self-censorship or disengagement from online activities to protect themselves from online harms. So as regards the legal framework and the regulatory approaches and measures, in a nutshell, quite a lot has happened in the legislative space in the last few years. This tells me one thing: the law is catching up, finally. The law is recognizing that these harms have evolved, have mutated to this online space, and they are worthy or deserving of attention, of amelioration. So 3 levels of what's been going on in the regulatory framework. So existing legislation has been updated and expanded to criminalize harmful activities in online spaces. Secondly, new legislation has been passed for the same reason. And thirdly, guess what? Future legislation is in the pipeline to enhance enforceability, and I think importantly also deterrence. So for existing legislative provisions that have been updated to reflect the fact that these crimes are taking place in the online environment, we have 3 statutes. You're going to hear me say 3 of some things quite often in this presentation. So we have the Protection of Harassment Act. I'm going to use the acronym POHA, the Penal Code, and the Broadcasting Act, three separate pieces of legislation, three statutes. First, POHA, the acts of cyber stalking, online harassment, and doxing, which is the publishing of private or identifying information of a person online with malicious intent, are now offences under POHA, punishable by substantial fines or imprisonment. So previously, before the update, POHA was about, I have to physically, in real life, harass you. Then, there is an action under this act. So then you have the Penal Code, the act of revenge porn, which is the leaking of nude images or recordings online without the consent of the person identifiable from the images or recordings, is addressed in updates to the Penal Code, which proscribes a range of related acts intended to cause shame, embarrassment, and reputation damage. What is good to know is that these acts do not just concern the distribution of the material online, but extend to possession of such material, as well as threats to distribute the same. So when I look at the words shame, embarrassment, and reputation, this is beyond physical, financial damage. This is emotional, psychological damage. This is important. So finally, we have the Broadcasting Act. You're probably, why do we have this? Why is the Broadcasting Act relevant? Only because the provision of internet services in Singapore is deemed a form of broadcasting. It's accessed by the public. So therefore, it comes under this. In July of 2023, the Code of Practice for Online Safety under the Broadcasting Act came into effect. Under the code, designated social media services are required to meet specific outcomes with respect to enhancing online safety for end users. So the code lists cyberbullying content as a category of harmful content. Designated social media services are required to comply with obligations in three categories: user safety, user reporting and resolution, not the word resolution, and accountability. So the designated social media services are, no surprises, Facebook, Hardware Zone, Instagram, TikTok, X, and YouTube. I believe that this is not a closed list. Other platforms may be added as time goes on. So in June 2024, the Online Criminal Harms Act, OCA, came into force. The aim of OCA is reinforcing protections for the public from online harms and provides more effective mechanisms for the authorities to deal with criminal activity online. So what is important to note is OCA does not in itself create new substantive online offenses, online harms offenses. It can be described as a means of extending existing enforcement mechanisms for prosecuting the online commission of harms offenses. So OCA functions as an enabling conduit for the enforcement of specified offenses and cyber activity offenses in respect of their commission in an online environment. So these are listed in parts 1 and 2 of the first schedule to OCA and encompass a wide range of offenses under statutes currently in force. So among these, the act of dissemination of intimate or voyeuristic material online is criminalized. The first schedule to OCA provides a list of specified offenses, which include the existing offenses under POHA and the Penal Code that I mentioned earlier. So significantly, OCA provides the government with the power to issue a range of directions to online services, including your social media platforms, where there is reasonable suspicion that an online service is enabling the conduct of criminal activity. So this act empowers officers from government agencies, from relevant government agencies, to issue a range of directions. And these 5 government directions are the Stop Communication Direction. The recipient of the order is to stop communicating the material online. The Disabling Direction, where online service providers are ordered to disable specified content from their service from the view of Singapore users. There's the Account Restriction Direction, which requires online service providers to stop an account from communicating in Singapore and or interacting with Singapore users. Then there's the Access Blocking Direction, which requires internet service providers to block Singapore users from accessing an online location, such as a web domain. And then there's the app removal direction, which requires app stores to remove an app so that Singapore users cannot download it. So that's the arsenal, if you like, of directions that can be used. So at one level, the existing POHA and Penal Code provisions give victims legal recourse and empower the authorities to act in cases where online harms have been caused. The addition of OCA provides another means of protection by mandating action on the part of online platforms and services to curtail the occurrence of harmful activity in the digital sphere. These OCA is relatively new. It only came into force last year. Difficult to speak of its effectiveness now, but surely should be the subject of ongoing study. It will also be interesting to observe how effective the interplay of these legislative provisions will be in addressing online harms, specifically online violence against women. Now, what is important though, you got a whole bunch of laws, right, already in force. But what is important though is that people are made aware that these avenues for recourse exist, that they are available to them, and be encouraged and importantly supported to use the same. So what efforts have been made in increasing awareness of these avenues of legal recourse? So SGH Empowerment, was launched in September 2022, and they have since established She Cares at SCWO, a support center for victims of online harms, in collaboration with the Singapore Council of Women's Organizations. It provides holistic support and a safe space for targets of online harms, particularly girls and women, to turn to when they encounter harmful behavior online. They have a telephone hotline and a text line that are manned by, very importantly, trained counselors. And it also provides free counseling services. Pro bono legal services and assistance is also provided by volunteer lawyers from the Law Society Pro Bono Services. I believe this happens 3 times a month at She Cares at SCWO. Further, in January of 2023, the Singapore Police Force worked with She in piloting an improved victim care process. If you think about the nature of these harms and the fact that most of the victims from these harms in Singapore statistically are women, and this is especially important. If She is the first touch point of victims for online harms, the police interview can take place at She Cares at SCWO's premises instead of at a police station. The context and the environment for receiving these victims and engaging with them, this is paramount. I think this is paramount because it sends a signal that there's actually consideration given to their mental state of being put in this situation. So this is very important for helping a victim feel that she is in a safe, trustworthy, and sympathetic context in which she can confidently receive support and assistance in seeking recourse. So finally, we look to the future. The Ministry of Digital Development, MDDI, and the Ministry of Law introduced the Online Safety, Relief and Accountability Bill for first reading in Parliament on 15th of October, just 2 weeks ago. So I was very excited to actually see there's an update, there's some movement in this area. So what this bill does, this bill is proposed to be made into law. It proposes new measures to strengthen online safety and protect Singaporeans from online harms. Again, it's victim empowerment, it's channels of recourse, and also, like I mentioned early on in my comments, hopefully to act as a deterrent. These are meant to complement the earlier measures I spoke about. 3 key measures. First, the bill will establish the new Online Safety Commission, a dedicated agency to administer a statutory reporting mechanism that will enable victims to seek timely remedies from specified online harms. The commission will be set up by the middle of 2026. So victims in most cases will be required to first report the harm they've experienced to the online service provider before submitting a report to the commission. For specified categories of online harms that warrant urgent relief, such as intimate image abuse and child abuse material, victims may seek remedies from the commission immediately. And this is the part that I have a little bit of problem with, that you first reported to the online service providers. But I suppose there are legitimate reasons for that. The Commission will be empowered upon receiving a report from a victim to issue directions to address the online harm. These include directions to take down the harmful content, restrict the perpetrator's online account, or allow the victim to post a reply. These directions may be issued to communicators of the harmful content, administrators of these online locations, or platforms where the harmful content is posted. So non-compliance is a criminal offense. In such cases, the Commission may also take additional measures, such as issuing an access blocking order or app removal order to put a stop to the harm. 13 categories of online harms addressed by the Commission. There's an annex to the bill, which is available online. If anyone's interested, I can provide the link. And the categories will be implemented in phases, starting with harms that are most serious and prevalent. Second, the bill will introduce statutory torts to clarify the duties and liabilities of 3 key stakeholders in the online ecosystem. Some explanation here of what a statutory tort is. This is entirely legalese here. A tort is a civil wrong. A statutory tort is a civil wrong that's created by a statute to recognize that this is a harmful situation. We will enable people who have been harmed the ability to sue, to take a civil case to court against a perpetrator of the harm, the person causing the damage, to sue for compensation. This is interesting, as so far the avenues of legal redress that I have mentioned all been criminal in nature. So this is the first time that the law is saying, okay, we're going to make all these online harms, we're going to describe them in terms of a tort, of a harm that we recognize in law that you can sue a person for in court. So the stakeholders are, again, the communicators, the person making the communication, the administrators, the person who is supposed to take care of the space in which all the activity happens, the online space, and the platforms themselves. So they all are now, or will be soon enough, under a duty of care not to do these things. And if they do these things, they could well be subject to a statutory tort lawsuit. So overall, these statutory torts provide victims with a clear cause of action against the above-mentioned parties and allow victims to seek redress from the court. Court will be able to grant remedies such as damages and injunctions, which an injunction is something where you order someone to stop a pattern of behavior or carrying out a certain behavior. There's more information in the annex to the bill, which I can provide, like I said, because right now it's just in the annex is just details of the harms, the description of the torts, and number of flow charts which actually show the process that could be embarked upon when you institute a claim. So this is a fairly novel approach to allow civil remedies where a victim could bring a lawsuit. Okay, we don't know yet whether this will be in addition to or alongside a criminal prosecution for harmful activities. And I think the main point here is this may have a decreased deterrent effect on the commission of online harms. So third, the bill will introduce measures to ensure that communicators of online harms, which often capitalize on online anonymity to commit harms with impunity, are better identified and held accountable. So the Commission will have the power to require platforms to turn over identity information of end users who are suspected of causing the harm. Bad actors may deliberately withhold their identity information from platforms. And this is pushing the owners on platforms, especially those with greater reach, to take further reasonable steps to collect information from communicators of online harms. So with all this in mind, what is important now for testing the effectiveness and robustness of this framework is firstly creating greater public awareness of these frameworks, so victims know where to seek redress and be assisted in doing so. What is imperative is that the government agencies behind these initiatives and policy moves really push the boat out as regards awareness raising and familiarizing the public about the same. So as an analogy, within Singapore, there have been significant awareness campaigns and public education efforts around cybercrime, scams is a big one, and also molestation, and also recently vaping, all right? So the same should be done, if it isn't already, for these aspects of online harms. I have yet to see this. As far as I am aware, and maybe Singapore residents, if you have seen education around this in public spaces, you can actually, comment or raise it in the Q&A, but yet to see it. And secondly, even more critical than increasing awareness of these channels of redress, working to create confidence in victims, and in seeking redress, they will be treated appropriately and sympathetically. As a former practicing lawyer, and on one hand, I'm seeing, oh great, you can bring a case to court, you can sue somebody for an online harm damage caused to you, and then I'm thinking, as a lawyer, having maybe worked with people who've gone through that court process, it takes time. There is publicity. Identities may or may not be protected. The stuff that is causing the harm online may have to stay online until it is determined that it is indeed a harm. So until the act is passed and we look at the language and what it provides, that is my paramount concern. Does this help? Does this truly help? What does success look like for these frameworks? Is success more reporting, more lawsuits, more criminal cases? On the flip side, that means two things. People are using these channels, which is great. But is it just that these have been so underreported that everything's coming to the surface now? And on the one hand, shouldn't we be focusing on actually working very hard to ensure that these cases don't even happen? So it's hard to say what success looks like here. But that's all I have for right now. Thank you for listening, and I hope you have found this presentation useful, and I look forward to your questions, if any. Thank you very much.
Thank you so much for sharing that update, Yi-Ling. It's I think it's really important that we have seen from Singapore's experience that importance of working on both existing, new, and future legislation, all as a continuous process in a continuum, rather than kind of being reactive to it. So this is planning ahead, looking forward. Of course, I think the exigency is there because of the very, I think, dynamic nature of this online violence and so on, where women are actually disproportionately affected, and that also prevents, I think, or hinders the steps that they can take to seeking redress. And the point that you shared about this working together, the civil society, the NGO working together with the police force, I think it's also a very good example of, I think, breaking down barriers where there's usually traditionally a bit of a mistrust, I think, in approaching authorities or figures in authority, so to speak. So the last point you had about, of course, hardware being as important as hardware, I think it's an ongoing process. And of course, I think here in Singapore, we're mostly known for slapping laws on people and enforcing the rules, but there is that human, the caring element to also letting people know about what tools there are to assist people and raising that awareness. And I think building that caring element into all of this is something that, of course, I think a lot more interest will be there in learning all about Singapore's experience. So thank you so much for taking the time to share that in detail. I'm learning as much as I listen and go along. So if I'm bad at timekeeping, apologies in advance to the audience. Our third speaker, Dr. Ayesha Abu Bakar, had a medical appointment. She's listening in. So I'm going to save Ayesha's intervention for the last, and then go on ahead now to Dr. Gabriela Fernando's intervention, which, as I understand from our brief conversation, will be looking at women's health. So over to you, Dr. Fernando, for your insights.
Thank you so very much, Dr. Mo. And again, a big thank you also to Dr. Tamara Nair and the team, and also the S. Rajaratnam Institute for this very kind invitation. As Dr. Mo introduced me, I'm Gabriela Fernando, and my area of work is broadly around global health, with a specific focus around women's health and equity. And I also, within my research, have a focus on the South and Southeast Asian region. So I think this conversation today is coming at a really interesting time for us, and I think a huge monumental milestone. And I'm hoping that today's conversation, at least with the work I'm presenting around women's health, sort of starts the conversation also about how we should think more about integrating and considering women's health in the conversation around WPS as well. So in terms of what I was hoping to talk to you about today is perhaps to give a quick setting of the scene of what women's health in the Indo-Pacific region looks like, and perhaps in a time space of 25 years. And also to talk about the WPS pillars in relation to women's health, the different areas of women's health. I think it's also important to acknowledge some of the emerging security threats that's taking place. And so I've chosen 3 specific areas: what we're seeing, natural and climate disasters. We see pandemics and outbreaks, as well as conflict and migration, also often affecting women, as well as their well-being and health. And I thought I will end this discussion with some best practices and some key recommendations as well. So I think, as I said before, at this pivotal mark of 25 years of celebrating women, peace and security, the agenda as it is, I think it's important that we better consider and integrate women's health and well-being into this conversation, into these actions. And I think it's important we do this because within the context of conflict, violence, displacement, we know that women often face far more disproportionate impacts, and particularly when it comes to health challenges. And yet, currently, as it stands, the framework, from what I've seen so far, it primarily looks at it through the lens of sexual and reproductive health and rights of women, as well as the broader areas around maternal health. And while this is critical, I was actually having this conversation with Dr. Tamara not so long ago. Whilst this is critical, we acknowledge that health is a fundamental human right, and that the need for health extends across an entire life course. And so it's important that more inclusive understandings are taken when it comes to women's health, and that it is also, not seen just from the angle of reproduction, but taking on a more life course approach, one that considers women's health from pre-puberty all the way to pre and post-menopause stages, which is often overlooked. And so we know that even in the evidence that while women are indeed vulnerable during pregnancy and reproductive years, the challenges of health can include the exposure to violence at very young or elderly age groups, that food insecurity affects a lot of young girls and women, that poor hygiene and sanitation affects, for example, menstrual health and care. And there's also issues around girls and women's mental health concerns, including suicide ideation and the prevalence of suicide. So I think all these matters need to be considered through more of a equity and justice-based framework. And it's important that we have this discussion more and more and try and better integrate that. So to start with, as I mentioned before, I think we'll take a look at what the Indo-Pacific region looks like when it comes to girls and women's health. And I've just included a brief summary here. Of course, if we were to go into specific details, I think we will gather the evidence a bit more. But what we're seeing is that women within the Indo-Pacific region are characterized by broadly a youthful age structure. So, for example, across Southeast Asia, we see that the age groups of 0 to 14 groups age groups is comprising of about 24% of the total population. And we also have elderly population that is above 60+ years of age, which is around 12.5 or 13% of the total population. And we do have this, you can say, a midpoint sort of a age demographic that makes up majority of the population group across this region, broadly speaking. But when we look at specific health issues, what we're seeing is that maternal mortality, I'll start with that, of course, that it has fallen overall, but throughout certain countries, these numbers are in fact getting worse. So, for example, we know that in countries like Singapore, there are significant strides that's been made to reduce the maternal mortality rate. And so it's around single digits or less for 100 per 1,000 live births. But there are countries like Indonesia, which is where I'm residing currently, where maternal mortality is high as 140 per 100,000 live births. And it's actually even higher for rural and remote regions of the country. You also have sexual and reproductive health and rights and services that have expanded beyond the 2000s mark. And yet, because of certain security threats, because of issues and challenges such as the recent pandemic or issues around displacement, we see that girls and women are having less access to basic sexual and reproductive needs. For example, family planning coverage. There are very high unintended pregnancy rates. In the Pacific region, I believe unintended pregnancy rates are as high as 51% per 1,000 girls aged between the ages of 15 and 19 years of age. We also know that menstrual hygiene, sanitation and hygiene are huge challenges where majority of girls, for example, in countries like Indonesia, remain still without access to proper and healthy menstrual products or items. We also have the issues of chronic and non-communicable diseases, which is a group of major diseases which comprise of cardiovascular diseases, heart disease, cancers, respiratory problems. And majority of the time we see that there are particular diseases, for example, diabetes, for example, particular cancers, as well as heart disease that's actually affecting women more. And this is to do with a compounded effects of both risk factors, lifestyle risk factors, but also the lack of screening as well as vaccination programs. For example, the cervical cancer vaccination programs, which are known to be preventative of deaths and mortality, but it is well below thresholds, the vaccination rates across these countries. We also know that mental health is rising, particularly amongst young girls, and these are compounded by effects of conflict, by the climate crisis, but also issues around bullying and other social issues as well. And a majority of the time we see that both within crisis situations and also in times of peace, there are issues around service gaps and also quite high stigma attached to particularly girls and women having the burden of mental health and psychological distress. Of course, it goes without saying that the rate of gender-based violence and violence against women have been persistent, and I think it's quite obvious to say that particularly during the time of COVID-19, the exposure and also the rates of gender-based violence just rose double, if not 3 times. And in certain contexts, it was over by a significant amount. And with the rates of gender-based violence and violence against women, we know that rates of HIV spread as well as STIs or sexually transmitted diseases are also persistently high, with little care given to both psychological support related to these incidences of violence, but also counseling for healthcare healthcare and health prevention is also low. Another point I want to make is also around the progress made around what we call universal healthcare or coverage, which is to better support people to access healthcare without financial harm. What we're seeing is that while some countries have made very good and significant progress, there still remains major financial barriers, particularly for women. And what we're seeing as a result of it is that women oftentimes delay or completely forego essential healthcare. And so many a times when women do come into hospitals or the healthcare settings, it's usually where a disease has progressed far beyond the stage of prevention. Last but least, I think what's related within the realm of women's or healthcare is that there is more and more the engagement of women within the health workforce, which is an incredible achievement, and yet the protection for women, particularly for women who are taking part in the healthcare workforce, whether it may be through decent work conditions, leadership, or even basic protection in terms of health protection for themselves, is quite limited. And it's particularly important to mention the role of women in more lower status or informal roles, for example, domestic care workers, whose contributions to health as well as care within domestic settings are often under or unrecognized completely. So I think as we speak about WPS and its pillars, I thought I will sort of look at integrating what women's health looks like within these pillars. And so what does protection really mean for women's health is, again, iterating and reiterating the point about the need to take a look at the life course approach and not just looking at women's health as the role of reproduction and pregnancy. It's important that we safeguard women's physical, mental, social, as well as the economic security before crises. I think that's where the protective role comes in when it comes to action. Prevention really means that we look at the root causes, or in health, what we call understanding the root determinants of health. And this is also where we can look at addressing power asymmetries that influences healthcare governance, the financing, the sponsorship, the funding, as well as access, utilization, and the health-seeking behaviors of the millions of women who are more at the grassroots. Participation is one that is also important, and this is where we're trying to encourage more and more to invest in ensuring that women's leadership and voices are at the center of decision-making, health decision-making, as well as the health response and planning and implementation. And actually, when you do that, what we're seeing is that women's role are also being championed. And I will speak on this in a tick, but we can really champion their role, particularly within their own communities. And that would take women's participation, a positive stride towards women's participation, but more importantly, also improving their own units, whether it may be a household at the community level, but also at the national health governance level. Last but not least, what it means for WPS pillars to sort of better think about women's health is also around continuity and also the equity of health and social protection services. This may range from, nutrition and food security during times of crises, in terms of immunization, in terms of chronic disease management, particularly when it comes to mental and psychological support, as well as the sexual and reproductive health and rights protection. And of course, the income and the livelihood safeguarding, which in turn does impact mental health and also health seeking as well. So I'm going to quickly run through the next couple of slides, actually, but I think in the discussion around what are some of the emerging threats, as I said, I've focused this presentation on three security threats. I wanted to highlight number one, the natural and climate disasters and the climate crisis that's currently taking place. We know that the Indo-Pacific region particularly is quite a climate vulnerable region. It's also one of the regions where women are at the center or at the front lines of dealing with very climate vulnerable sectors, whether it is in farming, whether it's in agriculture or in the agri-food system overall. And so what we're seeing is more and more with the current crisis, the environmental changes and the climate crises, we're seeing that women, for example, are experiencing food insecurity at a point where there is long-term hunger more amongst women because they do prioritize their families or their spouse in the context of being in these vulnerable, climate vulnerable contexts. And so what it has meant is that in countries like Indonesia, stunting rates are quite high, not only amongst children, but also amongst women. We see that there are issues around defunding as well as the reprioritization away from sexual and reproductive health and rights. And again, this compromises women's family planning processes, access to contraception, safe pregnancy and maternal care, proper and appropriate STI or HIV infection tests, safe abortions, menstrual health and hygiene, but also pre- and postmenopausal care for more elderly women as well. There's also issues around displacement and what this means for violence against women or gender-based violence. And this has quite a number of issues, both for more elderly women, but also younger children as well. We know that things like early marriages or school dropouts or even forced labor, child labor, is more common within these contexts. And when you think about it from a more health perspective, what we're seeing is that there are early pregnancies. There's also complications when it comes to pregnancies, and also high mental health issues amongst young girls who are in these situations, but also women of older age as well. The next thing I want to talk about is around outbreaks and pandemics. I think the evidence was quite clear in the sense that there were very disproportionate impacts of the COVID-19 pandemic, particularly on women. This was firstly to do with the double burden of domestic or unpaid work alongside juggling employment. And women also being at the front lines of more likely to be losing jobs and income, which actually affected their mental health, but also their income securing capacities, which did have health implications. Interestingly, there's also reports about how women were less likely to receive 2 COVID-19 doses, as well as information about the actual virus itself. And a lot of these issues was to do with the conditions of the virus or the pandemic, which was around restrictive access to information points, access to resources, health information, and so on. We also saw in the case of sexual and reproductive health, we saw that because of the reduced access to health facilities, that women were more likely to show up at the primary health units for more complicated birthing. And then there were also low facility-based deliveries as well, particularly during this time. Lastly, I think the third emerging threat that I wanted to highlight is around conflict and migration. Now, we know that the Indo-Pacific region is one of the common routes used in the pathway or the migration pathway. And a majority of the refugee and asylum seekers migrating across this region are actually women. And the reasons for this could be, for example, sex trafficking, labor exploitation, and also where there are high rates of violence as a result of it. And women's journeys, for example, in my own research here in Indonesia, we're finding that throughout women face very high rates of violence and security threats, all the way from leaving their home country, which could extend all the way to the Horn of Africa. throughout and whilst being in transit, and also during the move or the journey itself. And a lot of the time, the reason is because the places or the context that they're situated in, which is very health compromising detention conditions, they lack the necessary needs, I guess the gender sensitive or the more responsive needs that's required to maintain and also access timely and essential healthcare. And a lot of the women I speak to, at least in my work here in Indonesia and in Malaysia, we see that women who have gone through the migration, journey have very high levels of psychosocial stress, trauma, and also long-term mental health, which then also compounds their physical health problems as well. So I think to sort of round it off, I thought, what does it mean to really integrate or to think about integrating women's health into WPS pillars? I think starting with the prevention pillar, I think what's important is that we do strengthen those preventative programs. So it could be gender-based violence programs that do have an integrated program around healthcare as well. This could be mental health care programs. It could also be health protection programs specifically for women, and this could be around women's maternity. It could be for girls, and also health promotion around maintaining menstrual health and hygiene. And I think an example of this is coming from the Philippines, where there are women's friendly spaces, or WFS, as they call it, which is actually an interesting network, which is also in partnership with the barangay health emergency response teams, where they do equip women with both gender-based violence prevention as well as psychosocial awareness training to make sure that their mental health and well-being is protected, and that certain measures are taken to prevent them from further having issues around mental health, for example, in times of crisis where required. The second pillar around protection, I guess what we can think about is to guarantee more timely and safe access to women's healthcare needs. And this could be, needs, services, treatment, and medicines ranging from family planning programs all the way to safe birthing spaces, but also counseling and psychosocial support services. Protection should also include ways of supporting women's income and financial, and protecting them from financial hardship, because again, when women do want to access healthcare, many a times during these crisis contexts, we see that financial barriers are some of the main reasons as to why women are having access issues, and most likely foregoing or letting go of their own health. And so thinking about women's economic protection and financial well-being in these times is very important. And one of the interesting case studies came up, I was looking at this before actually, is Fiji's health sector. There's a gender policy which ensures that that women can access certain health services. There is non-discrimination, and there is privacy across all facilities. And this can range from maternal and child health all the way to women's psychological needs assessments as well. And then I guess it's the pillar around participation. And I think the message really here is to mainstream and institutionalize, or to better integrate women's voices into the healthcare governance space, health policy space, and also in the emergency response committees. And the way to do this is really by creating women's leadership pipelines. This is not just at a local level, but also at a national and perhaps in a regional health governance and diplomacy level. One of the interesting case studies comes from the Pacific, where there's the Pacific Women's Lead Initiative, which integrates gender equality training into health leadership programs, and this is particularly targeting women. And so the idea is that women are better, their capacity is better built to then take those lessons forward to their own communities. Last but not least, we look at relief and recovery. So this is where we think more about investing in the maintenance and the continuity of equitable and equal health services and opportunities. And an example of this comes from Indonesia, actually, where there is a specified budget by the government where they do hand out post-disaster health recovery packages. And this is done through what they call Dana Desa, which is one of the government bodies, but is widespread across the country, particularly at the more grassroots levels. And this is a very interesting, I think, program which is specifically targeting women and their households. And it's an interesting way of seeing how women's health is particularly protected and supported during times of post-disasters and recovery as well. So I think to end my presentation today and this conversation, what I was thinking was to perhaps reflect on a few key lessons and insights for you all to have a discussion about and to reflect on. I think the first point is really around raising and encouraging and prioritizing women's voices and health needs. I think it's important that we have women's voices, not just include women as you know, tokens or in a tokenistic way in the conversation, but really to allow women to take lead and be centered when it comes to program and policy designs, and that this goes beyond the health system, actually. Secondly, it's about strengthening women's participation and leadership. So again, putting women's voices first, putting women's place first. We think about how we can garner and look at all women across all society, whether it's grassroots, CSOs, NGOs, community leadership. And we think about ways of women's participation when it comes to, for example, early warning systems, healthcare delivery responses, and also health governance as well. Another point I wanted to make is actually the need to value women and realize that they're already doing some incredible work as first responders, particularly when it comes to health and healthcare. So oftentimes women are actually knowledge holders in communities, they're carers and also health champions. We saw that during the COVID-19 pandemic. We see that, for example, during the current climate issues going on within the region. And I think when you do invest in women's leadership, what you're seeing is that you can actually champion women and their role within their communities. And it could mean that you're transforming the health, the safety, and the livelihoods of women, as well as their communities at large. And then last but not least, I think as a future reflection is, and this is from a health point of view as well, is to think about investment in gender and sex disaggregated data. So when we are collecting data and information in the field, it's not just looking about, for example, just health issues. What we're looking at is really the nuances of disaggregated data, for example, sex and gender, age, disability, location. And what we're doing is we are recognizing particularly women's health needs, and then you can also link that data with some of the emerging emergencies, for example, climate data, for example, displacement data, or even the rates of gender-based violence that's persistent and that's coming up across the region. And I think that way, more projections in a preventative manner can be made. And it's also about safeguarding women, girls and women's health as well. I think that's it for me. I'm going to leave it there, and I'm very happy to have a conversation or questions moving forward. Thank you.
Thank you so much, Dr. Gabriela. That was a very comprehensive and informative, insightful, detailed sweep of how I think women's health, security concerns and needs are integral to any approach that we make when it comes to looking at these emerging threats or challenges, and how I think we really can't well, the word that comes to my overheated brain now is, divorce one from the other, in the sense that it's not addressing it after or even as part of. It's really integral in the sense that from the point of formulating responses onwards. I think you've highlighted very well. I mean, there will be points to unpack later, which we might do so if we have time for more detailed Q&A. Now, with another type of time constraint in mind, I'd like to give the floor the next 15 minutes to Dr. Ayesha Wee Abubakar, who's joining us in the midst of going through a series of tests. Aisa, thanks so much. And I think Dr. Gabriella's presentation gives a good segue into how do we integrate some of these important concerns when it comes to women's security, things that, topics or needs that we don't sometimes think of as emerging threats or challenges, but which nevertheless are important parts of addressing the emerging threats and challenges. With your experience in NAP formulation and inputs, what insights do you have to share for us today?
Okay, thank you so much, Dr. Mo. And again, I also extend my gratitude to RSIS, for organizing this webinar. And it's interesting how all of us speakers are really talking about WPS in various angles on our peace and security as women. So for my take, I will be talking more about how this WPS agenda from the Regional Plan of Action is now, how are we being introduced here in Malaysia since we have our National Action Plan recently. So I'll go first to the first slide. Okay. Okay. I will just read my point so that I don't go over time. So again, welcome everyone, and I will be sharing about how this WPS agenda is shaping here in Malaysia. As we all know, in ASEAN, it used to be that there are 3 member states that have produced and implemented national action plans, or NAPs, on WPS, and these are Philippines, Indonesia, and Vietnam. But soon after the launching of the ASEAN Regional Plan of Action on WPS, sometime in December 2022, we, the members of the ASEAN Women Peace Registry, that includes Dr. Tamara and Dr. Mo here, as members of the AWPR, we were then discussing either we should encourage more ASEAN member states to follow and produce as well their NAPs, or do we just encourage them to do mainstreaming of the WPS? That means WPS will be integrated in their existing government policies and institutions and programming. However, when we joined the first ASEAN WPS Summit in Jakarta in 2023, the AWPR ladies, actually, we were all united in saying and coming up with a statement, a public statement, which we published on the ASEAN IPR website. And we said that we want, all ASEAN member countries, member states should come up with their NAPs if we are to demonstrate our full commitment to the WPS agenda. And then finally, in this year's second ASEAN WPS Summit, shared by Malaysia, we've seen, how we have launched the Malaysian National Action Plan last September 9 in Kuala Lumpur. And so this Malaysian National Action Plan has been developed and implemented under the leadership of the Ministry of Women, Family, and Community Development, and with the participation of other ministries as well, including Ministry of Defense, Foreign Affairs, and Home Affairs. Among the ASEAN chartered bodies, it is in fact the ACWC, or the ASEAN Committee on the Promotion and Protection of the Rights of Women and Children, and the ACW, the ASEAN Committee on Women, that led the development of two initial groundwork for WPS in ASEAN. The first, we have the regional study on the ASEAN WPS published in 2021. And then second, we have the ASEAN Regional Plan of Action on WPS that was launched in December 2022 during the COVID pandemic. So we only had launching online. Okay. Note that these documents in ASEAN came up, after quite some time, since the adoption of the joint statement on the promotion of women, peace, and security in ASEAN during the 31st ASEAN Summit in 2017. Traditionally, representatives for ACW and ACWC are officials from ministries related to gender issues and gender mainstreaming, such as in the case of Malaysia. This would be, as I said, the Ministry of Women, Family, and Community Development. This ministry has also launched the National Women Policy for 2025 and 2030. So this is where everything about women's issues and women's programming is anchored on the National Women Policy. This policy focuses on the empowerment of women in 4 aspects. Maybe you can go to the next slide. Okay, next slide, please. Next slide. There is, that house. Okay, so on the left side, you have there the 4 aspects of the women policy, which has the pillars of economy, leadership, security, and well-being. And as a further development, the Malaysian National Action Plan on WPS is designed to fulfill that security aspect of the National Women Policy. So the Malaysian National Action Plan on WPS provides us with 4 pillars. Joey, can you go back to the earlier slide where we have the 4 pillars? Okay, so these are the 4 pillars for the Malaysian NAP. Not exactly the same as the WPS agenda pillar that we know of, from UN and also from the ASEAN Regional Plan of Action, because the first pillar is perspective. Now, what does this perspective mean? It says that this is about mainstreaming gender in a lot of the policies of the government, and the strategies that they want to emphasize on this perspective is that it has to be a systematic integration of gender mainstreaming in policy formulation, and there has to be increased awareness among the security organizations, and there has to be a capacity building for gender focal point and team. That means that the government is now wanting to identify who can be gender focal point and to organize a team in every, I assume it's every government department, and establish a national network on WPS. What sets the Malaysian National Action Plan apart from the UNWPS agenda and the ASEAN RPOA pillars is exactly this perspective. In a way, this has replaced the relief and recovery pillar that we can find in the WPS agenda. I can only guess that the relief and recovery must have been deemed as irrelevant or not applicable in the context of Malaysia, since when we look at relief and recovery, this pillar actually addresses the specific relief needs of women and girls in conflict and post-conflict situations. So something that is not in the context of Malaysia. And it's supposed to strengthen the capacity to act as agents of change in relief and recovery processes. But as we all know, those of us who are following the implementation of WPS, relief and recovery does not only apply in conflict and post-conflict situations, but it also apply in our normal, usual development agenda everywhere, especially when it comes to natural disasters and even, man-made disasters as well, can be part of this relief and recovery phase. The better news in this perspective pillar that has been introduced in the Malaysian NAP is that there is a plan of training gender focal point persons and to organize a team in many of these government agencies and establishment of a national network of WPS workers, I guess, or contributors. This hopefully will be an opportunity for more civil society participation on WPS in Malaysia. There have been an engagement between the ministry and the civil society groups on the NAP. Joey, can you go to the next slides? I think we have some pictures there. Okay, next slide. Next slide, please. Okay, next slide. And more. Oh, I think I missed the copy of the slide that I sent to Dr. Tamar earlier. So anyway, I'll continue. Can you go back again? No, I added there some pictures of the consultation between the Ministry of Women and Family and Community Development with the civil society organizations in Kuala Lumpur. In fairness, they've invited many NGOs from Sabah, Sarawak, and from Peninsular Malaysia. I also attended and joined in the discussion of the NAP. So for this first generation of NAP, naturally it's a top-down development of the NAP, but nonetheless, there is an effort of consulting the NGO networks. So, and given the and during the consultations, it is clear that there is so much interest among the NGOs on how they can align their work to the NAP when it comes to implementing and making, WPS work for all of us in the near future. Thus, the hope for the National Action Plan is high, and hopefully, we will be given more opportunities to participate in this NAP. At the ASEAN Institute for Peace and Reconciliation, or ASEAN IPR, where the ASEAN Women Peace Registry is hosted, we have had the chance recently to conduct a small research on women in peace processes. For the Malaysian research, we focused on finding out the participation of women in community mediation. So here in the slides, I'm showing to you some data about community mediation in Malaysia. Why community mediation? For the longest time, the Department of National Unity and Integration, or JPNIN, has actually been monitoring and recording conflicts that occur in the communities and neighborhoods throughout Malaysia, or what we call the Rukun Tetangga units. Thus, JPNIN has classified 9 types of conflicts, from neighborhood disputes, contracts and agreements, family disputes, land, infrastructure-related disputes, environment-related disputes, religion, consumer rights, and health. And with these type of conflicts, community mediation as a program has been introduced by this government agency. Since 2012, JPNIN has trained 571 community mediators, and out of this number, 27% are women. These mediators are either government staff, appointed community leaders, or informal community leaders. In our AWPR Malaysia study, we have invited some of these JPNIN trained women community mediators and more informal leaders who have not been formally trained in mediation, but by default have been practicing community mediation. Can you go to the next slide? I think we have some pictures of that. So this was the study that was hosted at Albuquerque International University, but we engaged other co-researchers as well from Sabah, Sarawak, and also here in Peninsula. So our partner universities are enumerated there. So in our study, next slide, please. It's a simple, really, it's a quick research, but what we found interesting in our roundtable discussions in all these regions in Malaysia, we found that women are very much involved in community mediation in various capacities. While the NAP on WPS sets the motion on the gender mainstreaming and the protection from violence and other security risks and the prevention of these problems, our study highlighted instead women's agency in the face of conflicts in the communities and neighborhoods, where these violence and security risks would be often experienced. We actually realized that women are already doing this participation as part of WPS. However, they are not recognized, and all the more because of non-recognition of their contribution. They can be put And precisely because they are not recognized, they can be put in further risks, especially in dealing with volatile conflicts that can turn violently as well. I am hopeful that with the first generation of the Malaysian NAP, more civil society women would want to be involved. But there has to be more promotion, understanding, and capacity building among Malaysians for WPS to be realized in our everyday life. So with that, I think the slides. Okay, I think just some more pictures. So this last slide, for you, all of you to be, if you wish to find out, in this AWPR research, we've actually identified a lot of all these women who are very active with their work related to WPS. So in ASEAN IPR website, you can find all these stories of women peace builders who are agents of WPS. So this is just an example. So hopefully we can get to see more of networking among community mediators, not only in Malaysia, but perhaps this is now the time that we also promote this idea of network of women mediators throughout ASEAN. And of course, a partnership between government, NGOs, and private organizations is really key if we want WPS to be implemented everywhere. Thank you.
Thank you so much, Ayesa. Thank you for doing this in between your blood test and CT scan. And it's really fascinating how you've highlighted the role of, involving the community level and the civil society for inputs that can help bridge policy as well as private organizations and so on. Probably we could dig a bit deeper into that if you're still around for the Q&A, but I'd like to now give the floor to Dr. Nicole George, who's been waiting very patiently to give her perspective on WPS and practices in the Pacific, which will, I think, really round out this rich discussion on, WPS 25 years in the Indo-Pacific. I mean, sometimes here in Southeast Asia, we tend to be a bit more, I guess, Southeast Asia or ASEAN specific, but we need to know the Pacific experience and what we can learn from it as well. And for that, we have Dr. Nicole George. Over to you, Dr. Nicole, and thank you once again for the patience.
Hi, sorry, can you see my slides? No, I don't think you can.
Yes,
can
we
see
can.
it?
It's full screen. We can see it.
You can see it? Okay, fantastic. Sorry about that. Okay, so what I want to talk about is research that I've been doing in the Pacific Islands. I'm just bear with me. Sorry, I've just got my presenter viewers dropped out. Okay, got it. What I've been doing is running a research project in collaboration with the Pacific Islands Forum on how to improve implementation of women, peace, and security in the Blue Pacific. And I've called my presentation today Beyond Command and Control, Aligning Women, Peace, and Security with Blue Pacific Security Objectives, because it's critically important for us to think about the extent to which in the Pacific, if this agenda is going to work, these are small Pacific Island states where they're relatively resource strapped, and it's really hard for them to find the wherewithal to develop national action plans that are going to be implementable, given that they have, as I said, not a lot of state resources to draw upon. But it's also critically important that they do implement women, peace, and security, because many of the challenges that the previous presenters have spoken about are also critical challenges in the Pacific Islands region. Just before I get further into this, let me also thank the organizers of the seminar today for their request to speak. I'm really delighted to be here and to contribute insights from this research. And just also, if I can do an acknowledgement of country and just share with you the fact that I'm living and working on the lands of the Jagera and Turrbal peoples, the Indigenous owners of the lands around Brisbane, and pay my respects to elders past, present, and emerging. Okay, so a little bit more about what I'll do. I just want to talk a little bit about the policy report that I have produced, and I also just want to make a mention of the woman I worked with from Solomon Islands National University, Femina Iabora, on this project. I'll talk a little bit about the methods and then the recommendations of the report. Just to say, it's not official yet, so it can't be distributed, but it will be official soon. It's just waiting for sign-off from the November meeting of the Forum Regional Security Committee. So why this focus? Why the focus on beyond command and control? Why I'm talking about the report in this way is that I think it won't be astonishing to many to understand that there are geopolitical tensions in the Pacific Islands region. And so what that has created is a lot of competition, bilateral and multilateral, where external partners are coming in to invest in security agencies, state security agencies, to train them up. And often this is done under the guise of peace, that having stronger security agencies will create peace in the Pacific. But a lot of women, peace and security advocates contest this idea and say, actually, what we need in the Pacific is less weaponry, less guns, and less security agencies, and more civilian peace building. We also see this command and control ethos very evident when there is crisis in the Pacific, periods of civil unrest occurring, for example, in New Caledonia or Solomon Islands. Often there is a military imperative to bring those situations under order again, with external forces brought in from outside the region to quell unrest. And what happens is that it sucks up all the oxygen and the space for women and civilian actors to work in the realm of peace building. We see similar things with environmental disaster responses. The Pacific is said to be on the front line of climate change, and we see very intense environmental crises in the Pacific, and often a highly militarized response from partners wanting to help. And we saw similar sort of authoritarian responses, not in all Pacific Island countries, but in some Pacific Island countries, to the management of the COVID-19 pandemic too. So I think it's fair to say that in all these kind of crisis situations, this securitization ethos is one that is very marked and very notable. And what the research for this guidance note encouraged me to think about the extent to which the imperative to order, to the restoration of order, could be more balanced, so that security, you may still need security forces at times, but there might be a dividend for peace that is more durable and sustainable also if we bring in more civilian, or we create space for more civilian peace initiatives, and particularly more women-led peace initiatives. So the idea was to create more balance, the idea of balance, to create and to focus on well-being, sustainability, and collective prosperity as key foundations for order. These are elements that are written into the Pacific Island Forum's 2050 strategy for the Blue Pacific continent. And it really draws attention to this document, which was agreed by all member states of the Pacific Island Forum. It really draws attention to the importance of recognizing non-traditional security threats. So as far as, the stakeholders that we spoke to were concerned, they wanted to see a women, peace and security strategy that really drew attention to these ideas for the Pacific, and to sort of ask, what place is there for civilian women in crisis response and peace building in the Pacific? The brief from the Pacific Islands Forum was not to encourage member states, a little bit different to ASEAN, not to encourage them necessarily to create national action plans, because often, even where these plans have been put in place by states in the past in the Pacific, they've not been well implemented or resourced, but rather to think about critical actions that could be taken. So my brief was really to identify high impact and low transaction activity that could be taken by Pacific Island states. So that's just a little bit about methodology. I'm not going to go into too much detail, but just to say, these are on the left-hand side of the slide, these are the sorts of activities we undertook for the research. We also undertook policy analysis of key security documents, both within member states, but also specifically focusing on the key security declarations that have been made by the Pacific Islands Forum, in addition, of course, to all the content of the various women, peace and security treaties, beginning with, of course, UN Security Council Resolution 1325, right through to the later resolutions. So all 10 of those, I believe we have 10 now. So what did so I identified 14 recommendations in all. Made 14 recommendations in all. I'm not going to go through all of them. I know that we're running out of time. I'll just go through a few select ones because I think you probably want to have some time for Q&A as well. So let me just sort of begin with the first one, which was to say to Pacific Island member states, or to make the recommendation that what needs to happen is actually for them to take up a policy audit, or undertake a policy audit to identify some places where they already have adherence or alignment with women, peace and security engagement in their national policy, and to identify 2 or 3 key areas where they could improve on that. So rather than putting a whole lot of resources and consultation into the development of a plan that may or may not be implemented, to take a much more targeted approach and work out what they're doing well and what they could build on from that area. The next thing that I wanted to, or that we identified as a key area of concern, and it actually is really, really interesting because it reflects something that was in this previous speaker's presentation, was the idea of developing a national registry of women peace mediators. We know these women are in the community. We know that they're very skilled peace builders. They often use important, critical, customary practices or faith-based practices to gain legitimacy in the community and to win acceptance of their interventions as peace mediators. In the last year, the Australian government has supported the development of a regional Pacific Women Mediators Network. And that's, it's gaining strength and it's gaining recognition, but it's not operating in the same way across all of the Pacific. So we thought as a further element to this initiative, there should be the development of national peace mediators that recognize actually National Peace Mediators Registry that is very focused on recognizing and integrating the diversity of Pacific women's experience as well. So not only concentrated in the cities, but also in rural areas, also making sure that women of diverse ethnicities and faith-based backgrounds are participating in that or recognized in that registry. And therefore, when crisis does erupt, you don't have to go far to find skilled people in the communities that are affected that can assist in maybe the mediation of conflict, or maybe providing advice for how best to recover from an environmental disaster. So the idea being that you don't have to scramble around to find the resources that are there in the community. You've already got a registry of people who might be able to help, particularly important, I think, for state planners when they're trying to confront crisis. The third recommendation was that PIF member states should conduct an audit of policy and practice within their state security agencies on where and how they've integrated women. We know that often one of the things that Pacific Island states do is to show compliance with women, peace and security is increase the recruitment of women. But this is very much shaped by an add women and stir sort of ethos or philosophy. And we know if you study institutions, I spend a lot of time studying institutions, that what that means is the gendered sort of masculinized practices of state security agencies are not challenged by women's presence. Women are expected to kind of transform themselves to fit within that masculinized ethos. So, we can see, I've just got some stats there on the slide that, across the Pacific Islands, we see between 8 and 24% of agency personnel, security agency personnel are women. and this is often celebrated as enhancing operational effectiveness. But our research also found that women face discrimination in a range of areas, that may be through the allocation of duties, access to promotion opportunities, access to training opportunities. A really interesting example was women find it very hard to get training to drive, to get licenses to drive police vehicles. And when you have access to a police vehicle, you can actually engage in the kind of policing work that maybe improves your chances for promotion. When I was sharing this insight with a group of policewomen from Vanuatu, their response was a few weeks later, they emailed me and said that they had engaged in their own fundraising to fund their ability to access driving lessons so that they could become licensed drivers, because they knew that would help their work. On the one hand, that's a great sort of, it demonstrates women's resourcefulness, but on the other hand, it also shows that, you know, there are no, it doesn't take much for women to be trained. It doesn't take much resources for women to be trained as drivers and to become licensed drivers, but no one's thought to do that. With all the money that's coming into the region to train, to build capacity in state security agencies, no donor, no funder has thought to fund women's driver training in these agencies. So that's just a small example, but I think it's quite a powerful one. We also suggested that there should be annual or biennial gender and security dialogues, which bring together for each member state, so have them at the national level and have them structured in a way that brings together state security agencies, civil society, policymakers, and women political representatives, so that people can start to think about what does it take, how do we sort of build a more comprehensive understanding of where the pressures and the threats to gendered insecurity are operating in these communities. And we suggested that maybe these could take a thematic focus each year. So you could have something maybe on health security one year, environmental security another year, conflict-related insecurity in another year. And so bringing stakeholders together, again, to build understanding, to kind of balance this state-centric ethos that tends to equate order with peace. And we know that many people have spoken about it today, but you know, the absence of violence does not necessarily mean peace. Order in the community can be opposed. It doesn't mean it's the, you know, it's sowing the seeds of durable peace. Again, another recommendation was that PIF member states develop national crisis response protocols to improve coordination between state agencies and regional partners. And that includes, you know, women civilian leaders and women peace leaders. So again, the idea was build on the impetus that might be generated through the development of a national peace registry, and also through holding annual dialogues, to then at a later point developing crisis response protocols. So people aren't making it up as they go along. Often what happens is the security agents, the countries where crisis occurs, they may have some kind of policy that requires them to consult with women, but they don't actually know how to do it. They don't know how to implement it. So putting in place these protocols, which sets them up with, you know, key implementable actions, we decided could be an important pathway forward. Another element that is critical and touches on things that other speakers have talked about is the anticipating and having policy and implementation strategies in place in the context of environmental disaster to deal with the spikes that we see in violence against women. We know this is a critical element when communities are afflicted by disaster, whether it be a health crisis, environmental disaster, or conflict, that there are spikes in gender violence. We know this happens. We should be better anticipating it. And there's no reason why there cannot be improved policy and planning to respond to this in a way that integrates the talents and skills of civil society actors already working in this place, and particularly women's organizations. There's very good women's organizations in many Pacific Island countries that are working on these issues. Their skills should be brought into the crisis response planning and implementation. I might just make this the last one. Let me see, we haven't talked much about DDR process. Well, I'd like to say two more things. On DDR, we see, and this is, I think, uniform across Southeast Asia and the Pacific, across the Indo-Pacific, the roles that women's organizations play in demobilization, disarmament, and conflict and crisis recovery. Often it's voluntary. I've worked in many communities across the Pacific who are recovering from conflict, and we know that goes on for decades sometimes. I've also observed that women often lead the response in their communities to this sort of civilian, voluntary-led efforts to rebuild societies and to sort of re-sew the seams of connectivity between groups of people. I've seen it in New Caledonia, I've seen it in Solomon Islands, I've seen it in Bougainville, I've seen it in Fiji. It's often work, as other speakers have said, that goes unrecognized. So the recommendation we made to the Pacific Islands Forum is that this has to be anticipated, and these women have to be better supported in the work that they're doing, but also they need to be brought in as experts in formalized discussions about crisis recovery as well, and particularly conflict recovery. And they're often marginalized and left out of the process. The final recommendation that I've just discussed is the need to integrate women into regional disarmament and demobilization programming, specifically where efforts are made to disarm militia groups, et cetera. We know from the ways these have operated in the past in the Pacific Islands region, all the benefits flow to men, and those benefits are not distributed equally throughout to families or in the community. And often women are both supporting combatants, but also they're dealing with all the injuries. They're playing caring roles in the community to support those who have been injured through their involvement in combat and armed conflict as well. So this has been a problem that's been identified for some time in the Pacific, but I think there's never actually been a policy or a recommendation that has specifically addressed this marginalization of women and the extent to which they are deprived of accessing financial benefit through these disarmament and demobilization schemes. And it's critical that in the future their interests are also recognized. I did have some further recommendations for the Pacific Islands Forum, but I'll just leave them there on the screen, and maybe I'll stop because it's 5:57 and I'm sure you want to have some Q&A.
Thank you so much, Dr. George. That was fascinating, and I hope we could probably benefit from getting the link to the study if when it's available, so that that can be one of the resources for whether it's for further research or policy planning purposes here. And I think that's something that I think RSIS can also hope to undertake and offer in I think fielding comments and questions that may come after audience members have had a chance to really, digest the very rich insights that have been shared today. I've asked for 10 extra minutes actually to be able to have some questions and discussions. I may be abusing my moderator's privilege. I'd like to start off with questions to each of our 5 esteemed speakers to really, I think, maybe dig deeper into some of the insights that we've all shared. Starting first with Excellency Carvalho, we heard a lot from you about women in security, in sustaining peace and all of that. Would you have any additional insights, ma'am, on economic security and how the pursuit of WPS implementation in Timor-Leste addresses this priority related to economic security? So that was my question for your consideration. To Yiling, I actually had an observation about, legislation, the aspects of legislation specific for women. We heard about the example and the good practice emerging with She and She Cares, working it on that. But is that only with relation to online harm, violence, or are there specific aspects in the legislation that address women's concerns? So that was one follow-up question that I had for you, Yiling. To Dr. Gabriella, the importance, I think, of integrating health into security sectors, I think, is very comprehensively covered and very empathetically dealt with. And your recommendations did include further, I think, integration between health and security. My question was, maybe you have further insights that we could benefit from with regard to the intersectionality, I think cross-sector, as well as the cross-border implications, because I think some of these, particularly when it comes to, I think, the migration and trafficking aspects and the women's health security concerns there, does go into other countries' jurisdictions. So whether there are, any possibility of, I guess, cross-border applications, applicability guidelines, if you will, if you could share further insights to that. Ayesa, if you're still online, I think what you shared about the role of mediators at the community level, with regard to, I guess, getting more input and trust for that level, and involving more, I think, civil society women to bridge policy and private organizations. Is that something that, okay, you shared it specific to the NAP process in Malaysia, but is this something that you see emerging in the ASEAN landscape? And finally, Dr. Nicole, the recommendations are fascinating, and I'm glad you could go through at least 10 of the 14. You mentioned some of the recommendation take-ups. How has that been overall, the take-up of recommendations from this study? And I'm personally interested, of course, in what you had observed about DDR and women's role in the recovery process. Could you maybe share a bit more details on what that covers? Whether there are truth-telling processes embedded in DDR? So those are like the questions for all five of you. Maybe I'll just give the floor again first to Excellency Elvira to start off. Your Excellency, you're still muted.
Yes,
Thank you.
Thank you very much for your question. The Secretary of State for Equality, one of our main role is to empower women's empower women in economical spheres. And we are also advocating for the enabling environment for women to participate actively in trade and economics through legislations and financial products such as credits and loans. And also, in particular, the Secretary of State for Equality also have a small fund to support and help the women's group and also some vulnerable women to have a capacity to so they will access the small fund to support them so they can have some productive activities to support to have other means of income to support their family. And also, it's not only the Secretary of State for Equality, but other line ministries, such as Ministry of Agriculture, the Secretary of State for Cooperatives, the Secretary of State for Employment, and other line ministries who also provide small, who have small funds to give to the to give to women's group to have to empower them and to support them to have productive activities. so they can have a small activities such as model is it? Model horticulture, horticultural, and also small activities to have to help them to have some incomes. So the government of Timor-Leste also focus on empowering women, women's not only women's political participation, but also we're trying our best to empower women's economic participation. And we are through the line ministries, we are working on enabling environment for women to participate actively in economic and trade activities. So and we believe that by empowering women in economics and by empowering them is one of the is essential for them to also prevent the gender-based violence in the family, because they also can contribute to the family. They also have a say in the family because they bring food, they contribute to the family in their daily life. So we are serious in investing on the women's economic empowerment.
Thank you. Thank you for that additional detail about economic security and empowerment, where you mentioned ensuring that via legislation as well as inter-ministry coordination. This gives a good segue to turn to Yi-Ling for your additional comments about the aspects of legislation specific for women.
And
For the
I have
question.
some.
Oh,
Sorry.
Yeah, go ahead, Yi-Ling.
all right.
Okay. So Yi-Ling,
Singapore legislation is, well, I think legislation in general is famously referenced by person. So harm can happen to anyone, but specifically for women, I had a quick look because it's been more than 2 decades since law school, and if you don't practice criminal law for a while, you tend to forget certain things. There are specific, more real world, in real life, protections for women in terms of outraging modesty, kidnapping and abduction, with the purpose to compel into marriage, right? Then there's prostitution-related offenses and voluntary causing miscarriage. And then the Women's Charter itself, that governs a whole bunch of stuff around marriage and protections for women. And then you have the Protection from Harassment Act, which has been updated. And then I think there is a criminal law related to domestic violence. Now, specifically for women, so like I said in my comments earlier, most of these in real life offenses have been updated where they can, where sensible. If they take place on an online sort of environment, they are taking place in an online environment, and the law recognizes that. But in terms of specific offenses that address harms against women in online locations, not specifically. Because, in fairness, this kind of harm can happen to persons across the whole gender spectrum.
Of course.
Yeah. So I think the language has to be neutral enough to be inclusive. And also the interpretation has to be sensible. The legal interpretation has to be sensible. So that's as far as I can see from my very quick, just kind of refresh for myself. I think
no, really, thank you. No, that's really important, because I think when we try to be inclusive, we sometimes tend to be exclusive. And I think there is that balance of, again, what you said by the neutrality, striving to be inclusive by being neutral, because there's this whole spectrum. Sorry, I cut you off. You had any final points to make?
No, just reiterating I think the point that I made in the last bit, where I just want to just reinforce the fact that the law is not a silver bullet.
Right.
It's really going to come down to how people are how victims are managed and cared for and informed. And this can't be within the purview of the ministries or the police or government agencies. Schools, community groups. We bring civil society into the mix, and to education as well. There's a lot of education or re-education of people in terms of their media literacy and their online behaviors and their cyber hygiene, that I think needs to be done and needs to be spoken about more. So as far as I'm concerned, this whole issue it's not gonna go away. I mean, people are people, and there are so many dark parts and dark behaviors that have been thrown up by the use of internet, the use of the internet, that we have to kind of like sit up and address now, and address fully as far as possible. So that's
Yes,
my last thought.
thank you. Yes, yes, I remember you did highlight the importance of the hardware part of the hardware implementation. And thank you for emphasizing that it is a whole of society endeavor and approach. So I think that's the main point of, again, interpretation and implementation of the law, which again, you've highlighted, it's not a silver bullet. So thank you once again for that additional clarification. And we are happy to share any of the links to the documents that you mentioned earlier in your presentation via the RSIS platform, when we'll be posting later summaries and of course recordings later on. So thank you once again, Yining. Turning now to Dr. Gabriella. Any additional intervention points you had about the intersectionality and cross-border implications?
Yeah, that's actually a really good question. Thank you so much for that, Dr. Mo. I think the one example that comes to my head at the moment is probably the situation around the arrival of the Rohingya communities or the refugees coming in from Bangladesh, where they are from Myanmar, and they're coming via Bangladesh. And here in Indonesia, actually, it created quite a lot of news, I believe, end of last year / early this year, mainly around their arrival. Now, interestingly, when we talk about sort of cross-border policies, Indonesia is not a ratified member state of the 1951 Refugee Convention. And so what that means for anyone coming in is that they are in legal limbo when they are coming here on transit. And I think that's an interesting sort of a case study to look at. In fact, I do work with some of the transit refugee women here in Indonesia, mainly in Jakarta, actually. And when you look at it from a health perspective, most of these women are it's actually women and children. Most of these women are younger by age. And when it comes to health vulnerabilities, we see that malnutrition, dehydration, and also risks of disease, for example, hepatitis. We also know that sexual infection are quite high. Now, the Indonesian government has sort of stated that they are willing to provide temporary accommodation on the grounds of, humanitarian support. And there has been quite a lot of health-related support that the IOM and also other NGOs have provided to these communities. So I don't think that it's specifically, concreted policy that's there, cross-border policies when we talk about women, peace and security. But this is, I think, an example where such measures can be taken, and perhaps, again, thinking about how to better integrate and prioritize actually women's health and well-being in a crisis situation like conflict and migration. yeah, I'll leave it at that.
Thank you so much, Dr. Gabriella. I think that's an excellent example that you raised because the Rohingya refugee situation, of course, in Southeast Asia does highlight how I think the policies of different departments when it comes to treatment of refugees and their arrival and sometimes also their detention and deportment. I think deporting them back. I think these are all very important points about how different state agencies actually sometimes have conflicting policies. And of course, we could even go into the details of refugee, I think, registration, treatment, their access to health care services, their right to work and all of that, which are still very much, I think, emerging areas being tested, being, I think, discussed right now very nascently. But thank you for bringing that up. It is an important case study, and I hope we'll see future research on that as well. Turning to Ayesa for your comments.
Yeah, I'm really glad to also listen to all the work that everybody here has been doing. And I also learned a lot, and yeah, especially with what Dr. Nicole has been sharing us. She mentioned something about how the women in the communities, to some extent, a lot of their insecurity actually comes from simple things, being able to drive, being able maybe to swim, self-defense and all that. I mean, it might sound too simple for programming, in terms of capacity building, but these are the life skills that are important so that we can strengthen security in our communities. And it really, to us, who have been part of this community, women in community mediation research, we've actually realized, a lot of all those issues that we are tackling internationally in terms of implementing WPS, whether it's, conflict affected areas or whether, the usual peace and security discussions internationally, we can actually see the parallels of that at the community level with a variety of the insecurity issues of all women and girls. So that's why it's so important that national action plans should be reflective as well at that level, at the community level, and only then can we, connect it, as part of the national action plan. Because as it is, when I presented earlier the national action plan for Malaysia, I have to admit it's very traditional security centric, but it's the first generation national action plan. So hopefully it will improve over time. Thank you.
Thank you so much, Ayesha, and also linking to Dr. Nicole's observations. So now that's a segue to turn to Dr. Nicole George for the comments that I had.
Thank you. And yes, I agree with Dr. Ayesha. It's been so nice actually to listen to all the presentations and see where the crossovers lie. And there is crossovers. I didn't mention technology facilitated gender violence in the Pacific, but it is really a thing as well. And we often see I think they're talking about 50% of people now having smartphones across countries, and that's including very remote parts of the Pacific. But we often see elite women being targeted with this kind of online abuse and misinformation too. So it's, it's a feature of society everywhere, of course, but also in the Pacific. But yes, the community peace building thing is really interesting. Just on that, so in answer to your question, Dr. Mo, has there been take up of the recommendations? No, because they haven't been published yet. But I would say where there have been national action plans, implementation has been, I always say, contrary, and I think this is really contrary to the ASEAN experience. In the Pacific Island states shouldn't be sinking resources into national action plans because they put so much work into creating the plans, and they have national consultations, and they spend a fortune on that. And then there's no resourcing to implement the plan. So it just gathers dust in the bottom drawer of someone's office. And even with the best intention, people, donor agencies say, oh, yes, we'll fund this element of the plan, but it doesn't happen. So that's a real challenge. But just on the DDR question that you posed me, I just thought I might share a little story just to finish off. And it gets back to the community peace building sort of element of women, peace and security, because in Bougainville, there was a very violent conflict in the 80s and 90s. You know, we're estimating between 2,000 and 10,000 people killed. We don't really know how many people were killed. And women played an absolutely critical role as civilian peace builders at the community level when all the lines of conflict broke down and violence was completely uncontrolled. And they were the ones mediating, standing between, you know, lines of people wanting to fight and using customary protocols to try and mediate this tension. And they often talked about themselves as the mothers of peace. We are the mothers of peace. And they invoked matrilineal sort of customary practices to legitimate their role. And of course, what happens if you're a mother of peace? When the peace negotiations happen, how many women get to sit around the table? You're probably not going to be surprised, not very many. But the ex-combatants, of course, all got round the peace table, and the DDR process was, of course, shaped to meet their demands because they were the most violent people in the community, and they needed to be, I guess, you know, brought into the fold. But you know, today, women peace mediators say to me, the worst thing we could ever have done at that time was to call ourselves mothers of peace. They say we should have called ourselves warriors for peace. Because if we called ourselves warriors for peace, they would have taken us more seriously and our role would be remembered today. So they talk about the ongoing marginalization of their roles because of this motherhood lens, which resonated culturally, and it resonated in the faith-based communities that they were working with as well. It was very powerful. But it meant that, you know, external agents didn't take them seriously. External donors didn't take them seriously. All the negotiation was done with the protagonists of violence. So I just think it's quite an interesting. So part of my recommendation on DDR was to actually say, we need to memorialize women peace builders in the same way we memorialize combatants.
That is so important. And thank you so much for that, because it is something that I think here in Southeast Asia, we also grapple with. And I think even, you know, the terminology raises this really, I think, complex reality, you know. The language of peace has been securitized.
Yes.
We talk about women, peace, and security, but the securitization of the narrative and the language, I think, puts all of us who really want to mediate for peace in very difficult situations, adding another layer to the complexity. Yes, I've gone over time, so with everyone's indulgence, and I think because the discussions has been so rich and insightful, we don't have questions at the moment. But if there are questions coming in later on, I would encourage members of the audience to email your questions to our RSIS organizers, which I think we can seek the indulgence of our esteemed panelists to help provide more details. And any links to studies and reports that have been mentioned in this webinar, I think we're happy to help share onwards for information. So in the very few minutes remaining, let me once again impose on the indulgence of the speakers, this time going by reverse order, to give your 5-second wrap-up thoughts on the future of pursuing the emerging threats for WPS in the Indo-Pacific. Dr. Nicole, start with you.
That's a hard job to do first. I guess I would say I think it's important to be optimistic. I think we can feel very bleak at the moment with the way global politics is functioning. But, you know, I do see points of hope. And I just, you know, I always just am inspired by those women who are against the odds, you know, those community women who are trying to sew their communities back together and just doing things with nothing and building amazing initiatives. So I take hope from them, and that's why I refuse to be pessimistic, even though it's easy to be pessimistic. So that's what I'm going to say. You know, as long as we're having gatherings like this, I think we can't just got to keep smiling, got to keep pushing.
I completely second that. Yes, we need to remain optimistic and inspired to keep the voices keep the voices being heard. Ayesa, your 5 seconds.
Okay, thank you, Dr. Mo. Yeah, recently I've been joining all these workshops by the ASEAN Intergovernmental Commission for Human Rights, the ICHAR. And fortunately, as an output of the ICHAR, they were able to sign this declaration on peace and development. So that has come out. And for sure, in the near future, there will also be mechanisms towards that. But one thing that I've experienced, attending all these ASEAN related meetings and working meetings really, is that it's true what Dr. Mo said. It's the language, something has got to do with the language, because ASEAN is allergic, to a lot of all these languages, including feminism, including patriarchy. When we know for a fact that patriarchy is the root cause of why we are, we continue to have male dominance in even in peace and especially in peace and security. So I think, we also, and as peace builders and peace activists and scholars, we have also to not really compromise, but we have to learn, to make full use of the language that is acceptable to the many. Fortunately, WPS agenda seems to be acceptable to all ASEAN member countries. So let's make use of that, and instead of other politically charged languages. So I think with that, WPS is something that we can do in our region. Thank you.
Thank you so much. I think that's really important because, one of the, I guess, common gripes we have is how gender blind has been ASEAN declarations. But you raise a very important reminder. It's working within the parameters that we have to continue pushing it. And well, thank goodness that WPS is an accepted term and they're doing something about it after years. Thank you again, Ayesha. Back to your tests, I think. I hope they all come out great. The test results, I hope the test results all come out great. Okay, Dr. Gabriella, your 5-second wrap-up takeaway thoughts.
Yeah, I mean, I was just going to say, reiterating the statement that, human health is a fundamental, basic human right. I think it's to try and encourage us to think about health and better integrate health within the realm of peace and security for women, for their children, and also their communities. I think that's so important. And I do have hope that as we're having these conversations, just like Dr. Nicole said, just like Dr. Ayesa mentioned, I do have hope that we are moving towards that. We are better recognizing that women's health and well-being is also at the crux of peace and security, and what that means. So I am hopeful that we are moving towards that, and more positive strides will be taken. Yeah.
Thank you so much. And yes, we just have to continue making sure that the hopes get realized. Yiling, over to you for your 5-second wrap-up thoughts.
I should know how to unmute myself by now, and oh my God. 4 words beginning with E. Education, empathy, I forgot. Education, empathy, engagement ahead of empowerment. I think those are fundamental to actually ensuring that women are in a better place. Women and girls are in a better place to actually stand up for themselves and speak without shame, and deal with being the target of online harms without shame, or with much less shame and fear than they are currently feeling, because that is the goal of a perpetrator of online harms, to make you feel shame and worthlessness, and to make you feel minimized to the point that you will not do anything about it. So you have the framework, but let's look at how women can be properly empowered, or let's to be more inclusive to people who suffer online harms, can be properly empowered and stand up for themselves with the support of the community. Yeah, that's it.
Thank you. Thank you. That is so important. And I think this is something that, it's been decades, if not centuries, of how women's voices, when they try to assert voices, always tend to be, I think, viewed or dealt with. So thank you for those 3 E's: education, empathy, engagement, ahead of empowerment. Thank you so much, Yiling. Excellency Elvira, you have the last word for your 5-second wrap-up intervention before we close. You're on mute.
Okay. Timor-Leste is committed on the implementation of the Women, Peace and Security Resolution, and we are working with a coordinated and integrated effort, and to make sure that line ministries have implemented this Women, Peace and Security, and we have to be prepared for whatever is coming, because we are not dealing with the traditional threat. We are going to deal with other threats that are coming other than a traditional threat. So we have to have elaborate efforts to tackle the threat, and I hope that these discussions, small discussions, will contribute to our future better implementation of gender, peace, and security in the region. And we have to be prepared for whatever is coming, because the threat is going to be not traditional, but going to be very complicated in the future with the presence of AI and other threats in the region.
Thank you so much. And I think from the presentations today, I hope you and your team have got much more inputs to inform your future integrative and inclusive policies, and also contribute back at the regional level in the ASEAN community. To all our online participants, to our speakers, once again, my deep appreciation and sincere thanks for staying on beyond the hour and sharing your insights and contributions, and of course to our audience members for staying on and listening. And I hope that these very rich discussions have been an input to the work and the research that all of you are doing. Do watch out for the RSIS to post the webinars, part A and part B, and of course any further information that we can help to facilitate and share in this learning journey together, for also advocating and voicing what needs to be done to address these emerging challenges for women, peace and security in the next years beyond the 25th anniversary. Once again, sincere thanks and a big round of applause. It's virtual, of course, to all our esteemed speakers. And I hope to see either or all of you again in future conversations on this topic.